Today we have two incredibly outstanding leaders, Jose Sanchez and Dr. Selwyn Rogers, and we're really excited to honor them with this first inaugural luncheon, which will help our scouts, especially those in the inner city of Chicago who need our help.
When Bob Barish and I sat down and I tried to identify who would be the inaugural recipients, we both independently chose Jose, and we did this because Jose has been an exemplary healthcare leader, one with strength, fortitude, but even more than that, vision. It turns out we were also unanimously aligned on picking Dr. Selwyn Rogers.
He's such a dynamic, influential leader, committed to the community, committed to his patients, clearly one of our superstars in the field of trauma and emergency care. It's just so exciting for him to be one of our honorees today. Jose is one of the greatest health leaders, not only in Chicago, but the United States. And we're so fortunate to have his leadership here in Chicago.
As a CEO of one of the signature safety net institutions of the city of Chicago, you can't solve problems of health inequity with small ideas. You need big ideas. And I would say that characterizes Jose to his core.
When Jose came to our hospital was dying. But Jose took it to a place where it is now thriving.
The hospital had very deep financial problems, and certainly the quality of the service was subpar.
He has spent his entire career in revitalizing Humboldt Park Health Hospital and enhancing the health and welfare of the community in which the hospital resides.
He worked to develop relationships with community organizations that help the youth, that help the elderly. He wanted to understand and help to create a healthy community.
He's done more than just turn it around. It is now a beacon of all safety net hospitals. It's one of the leading hospitals in the state of Illinois, and it's a model for healthcare services in general.
The values of Jose R. Sanchez are compassion, loyalty, and giving. He's a very generous person.
Commitment, hard work, and dedication to the community.
He's strong-willed, but he's a flexible thinker. Very firm, but he's open-minded at the same time.
Mr. Sanchez does not take no for an answer. He engages the board fully in his decision-making, and he has been a pleasure to work with.
I've been on the board for the last 10 years and witnessed his tenacity, his leadership, his loyalty, and his compassion.
Jose is deserving of this award because of his commitment to the growth of our youth in our communities. He understands that they need opportunities for leadership, opportunities for mentorship, opportunities to face challenges and grow their creativity as well. He understands that they are a key part of the health of our communities, and they need vehicles like the Boy Scouts to grow and thrive.
I don't know anybody who works harder than Dr. Rogers. He's on call 24 hours a day. I'm with him sometimes when his pager goes off. He's committed to the university. He's committed to the community.
I remember one of the first cases we did together as I was surgical attending. He was surgical resident in training, and he was well prepared. He was sharp. He was, all eyes on.
Just a tremendous amount of respect and admiration and awe for him when I first met him as a medical student. He was just so incredibly confident and thoughtful and sincere and compassionate.
You meet him and you meet people who have met him and recognize that each of them have had the experience of being looked at straight in the eye, being listened to, being heard, and in a short bit of time, understood and known, and then also amplified and pushed forward.
He is driven by his core values. He does what he thinks is right. And I've seen him do that at high cost, at high personal and professional cost at times.
A big thinker about how the problems in society, particularly the unresolved problems, the structural problems like racism and economic deprivation, we're connected into problems that we face every day in healthcare delivery.
If I had to pick one word, it would be dedication to people and causes. And early on, of course, that was with his patients. But as he's advanced in his career, it's also in a public health lens. And I think the third value would be the importance of giving back.
He and I have had conversations where he's been very clear with me that I needed to do what I thought was right for me and what I thought was right for my patients, whether or not that was aligned with what he needed as my boss, my division chief, my mentor. And that has shown me what it means to be a great mentor, to be a thoughtful friend, to be a sponsor, to be an ally, and also to be a leader.
Selwyn has, as a mentor, has a remarkable capacity and models the essential mentoring role of seeing the individual fully, appreciating them, understanding their own goals and vision, and also seeing their potential and seeing beyond them. There are people who are now in roles of influence to do good throughout the country and around the world thanks to Selwyn.
It's really hard to imagine somebody who has done more in academic surgery and public health to improve the lives of so many people, and who is really at such a critical phase of his career and his life where he will continue to do that. I mean, it's really a wonderful time for him to receive this honor.